Hi, welcome. My name is San, and my goal is to bring useful information to you so you can have the best health outcomes possible. So let's get started. This is the most important. This is where all the pieces come together for you. And this is where you need to put this plan into action. So that's where I have prepared this checklist, this plan for you. So first step first is if you have been diagnosed, then you'll want to determine where you want to be getting your treatment, what center, what provider, what team. Okay, get all that information. Get information about your treatment and your plan of care, document it, and make sure you are at peace with it. There'll be some things that you want to understand, and that's okay. You can go through it, and there's some things you you may not want to understand. Yeah, or some of you may not feel like I need to understand every little thing, and that's totally okay. It's not required. But just being at peace with it, that yes, I'm going for this treatment and I'm okay with it, I want to go for it. So being at peace with your plan of care, figure out how you're going to handle this emotionally, because it is an emotionally difficult journey, going through cancer, going through cancer treatment, or going through it for your loved one. So figure out your emotional well-being. Plan for the community, who's going to be your cheerleader, who's going to be your community, your village that's going to support you. Whether you are the patient or you are the caregiver, you'll want a community around you so that you can get through it and you have some support along the way, whether that's your clinical team, whether that's your supportive care team with your nutritionist or your psychotherapist, or it's your friends, it's your neighbors, it's your family members, whatever that is, have the community around you. Plan around your finances and your financial concerns if you have any, so you can get those addressed and you are at peace with being able to go through this treatment. Plan for your symptoms and side effects, what to expect, what you want to do about them, how you can handle them. Okay, and then when you're going for your actual treatment, then plan your get your treatment bag ready, get your meals ready, get all the dates and all the information ready, so that you can be fully prepared. And when you walk in, you have everything that you need to be able to have the best outcomes, and you feel grounded when you are going in, because you know what is happening to you and why it's happening to you and what you can expect. So in terms of looking after your emotional well-being, you know best what works for you. These are some ideas I've listed here, but think about what is it for you. So I suggest pausing this video here and writing down your emotional well-being plan. What are you going to do for your well-being every day, every week? What is the commitment you're going to make for yourself? Does it help you to do journaling? Is that what you're going to do? Or does it help you to exercise? Or does it help you to spend time talking to your family members, or whatever that is for you? Come up with a couple of activities that you are committing to yourself that you're going to do every day for your emotional well-being. Make sure you write that on a piece of paper or on your in your plan before you go forward. Come up with your community. So pause again the video here and make a list of all the people who you can reach out to, who will be there to help you, and in what capacity you think they can help you and you want to ask them, and get that commitment from them. So make that list right now of the people that you're going to be calling. Like maybe there are friends you want to call just to chit chat and talk about some TV shows, and that's fun. And then there are other friends you want to call and ask them about specific healthcare questions. And then there's some others that you want to go and visit your massage therapist or your psychotherapist every week, whatever that is. Make that list right now. Okay. So pause it, make that list for yourself, and then go forward. Now, when you're going through the treatment, with most treatments, it's recommended that you either take full time off or you take partial time off. So you'll want to find that out for your treatment. What kind of energy level can you expect? What is expected in terms of time off? So again, you'll want to plan for that and then work on that. So make a note, make this in your checklist, whether you have this figured out or not. If not, then add it to your list and find that out from your clinical team, and then find it out from your place of work. We have a full workshop on this, on planning time off from work, returning to work, planning your leave, your disability, short-term, long-term disability. So you can go to those particular modules to go over this whole immersion on planning this whole time off, and also managing your finances around it. So that brings me to the financial concerns. If you're taking time off from work, is there disability you can apply for, short-term or long-term disability? Are there other financial resources available? Do you have access to some supplemental insurance plan? Are there resources in the community? Are there some scholarships, grants, GoFundMe kind of campaigns? So those are the different kind of things you'll want to think about if in terms of getting your finances in order. Again, on this topic, we have full immersion workshop, so you can go through that one if you are thinking about finances. We talked about this. You want to plan, list out your treatment, and then list out what are the side effects associated with the treatment, and then how you're going to manage those side effects. If you're using HelpSee platform, then you'll see those side effects mapped out for you with the different treatments and entire recommendation repository and resources across many different healing modalities, all evidence-based. So you can use that for planning for managing the side effects. Otherwise, you can search for those on your own and figure out how you're going to manage those side effects. And then, of course, you want to get your treatment bag ready. It's nice to get that ready beforehand because you can think about it and put little things that you can be excited about. I see sometimes people bringing their knitting equipment. My friends have taken drawing books. They have taken all kinds of jewelry making when they're going for their treatment. So whatever it is that's fun for you, you can add some fun things to do with your treatment, or bring someone. Plan your transportation beforehand, so that that's another thing that's out of the way. You don't have to think about it. Meals. So when you're going through the treatment and several days after, you may not be feeling so good. So you'll want to plan for your meals, getting them ready beforehand, knowing what you will be comfortable eating, having some options around, healthy options around, and having those meals ready for you so that when you're going through the treatment, you're okay. Or if you are planning to have your friends and family help you in this, or they're offering to, you can ask them to bring something for you. We have an entire series on nutrition and meals related to different types of cancers and different kind of like head and neck and other issues. So if you have like specific meal related or nutrition related questions or want to know for your cancer, then you can refer to those particular modules. Make a note of your appointments that are coming up, and then whether you're using our platform for tracking it or you're tracking it in a notebook. Keep track of your appointments and your follow-up visits. Find out who is your navigator or your coach. It's always really helpful to have one person who's you're going to be your main point of contact, like a navigator or a coach or a case manager, so that this person is is kind of your connection to everybody at the center, and they are following you throughout the journey. So it's something to check and find out if you could be assigned a navigator. We serve as navigators. Our clinic serves as navigators for many cancer patients and for some health plans. So if we are eligible to be that navigator for you, we are happy to serve you. Our program is also covered under FSA, HSA. So if your center doesn't have a navigator, or you are looking to have a navigator to help you, you can even use your FSA, HSA dollars to participate in our program for navigation. We have group and individual programs for it. Okay, but always it's good to have one point of contact, one person who's going to be there to guide you and support you in this journey. Right. It's been a pleasure serving you and guiding you through this. I hope all this is helpful. My goal, as it says here, is to always be by your side and to guide you in this journey. Just remember, it's you can do this. It's a tough journey, but you've been through many tough things in your life, and you've come out the other side stronger and better. And it's okay to lay down the load sometimes and rest. Both are okay. You'll get through this, and you have it in you. All right, we are here to guide you. We are here to support you throughout this journey. Keep connected with us. Stay on our Facebook group. We will have a lot of educational videos and podcasts and series. You can watch those. If you have questions on any topic, we will have some live events coming up soon. You can attend those. And if you want to continue your journey with us, we are opening up a few spots in our group and private consult program through the clinic, which I mentioned to you is already covered by many insurances or by FSA, HSA. So you could sign up for that program. I'll send you information on that. All right. Again, I thank you so much for your time. Thank you for being here. And it's truly an honor to serve you. And I wish you the very best on this journey. Thank you for watching. If you would like to know about more content along these lines, then hit the subscribe button and the notification bell, so you'll be informed when we create more. If you like this video or you have some thoughts to share, then please comment and hit the like button. And you can always reach us on our platform and the different sites which I've put in the description below. Thank you, and my best wishes to you on your healthcare journey.